The series opens with a plastic surgeon confronting a case unlike anything he has faced throughout his entire career, as the patient in front of him suffers from extreme obesity, a condition so severe that it immediately stands out. And when she admits that she has an intense fear of needles, the surgeon gently tries to calm her down. Yet, anesthetizing her requires more than 100 injections. At that moment, she reveals that the people who led her to this condition are actually the ones closest to her, Sean and Troy, both plastic surgeons working together in a shared clinic. Although each of them holds completely different standards of beauty, as Sean is calm and responsible, far more focused on his home and family, while Troy lives recklessly from one day to the next, caring little about anyone else, driven only by appearances, money, and women. Then we see how every day they receive different cases, always starting with the same question, asking patients to explain what they dislike about their looks or their bodies. Eventually, the first case arrives to Troy. He asks his usual question, and Peacock replies sarcastically, saying that almost everything about her bothers her. Suddenly, their conversation is interrupted by Grace, who introduces herself as the new psychologist. Noticing that Troy seems busy, she politely excuses herself and says she will come back another time. However, he stops her and asks her to come in and join them, sensing that the woman in front of him needs a psychologist far more than she needs a plastic surgeon, someone who can convince her that she is beautiful without putting herself in danger or undergoing countless unnecessary surgeries just to feel satisfied with her body. Then he turns back to Peacock and asks her about the specific procedures she wants, and she explains that she wants full-body liposuction, a slightly smaller nose, along with a procedure to remove the stretch marks that deeply bother her. While she speaks, he carefully writes down every detail she mentions, including the number of surgeries required. Eventually, she tells him that she traveled a long distance just to see him and saved a large amount of money to finally get rid of her obesity and look better, especially since her graduation party is next month, and she wants to appear special in front of her classmates after years of constant mocking and bullying, making it clear that she went through an extremely difficult period because of her weight and the way people treated her, until she finally decided to have surgery as a way to escape the bullying and the judgmental looks that followed her everywhere. At that moment, he reassures her that she will be the most beautiful woman at the graduation party, agreeing to take on her case, which instantly fills her with joy as she thanks him sincerely. Meanwhile, on the other side, we see Sean after being urgently called to examine a specific case at the patient's home, something that immediately surprises him since he is used to patients coming to his clinic, not the other way around. Once he arrives, he finds the entire street crowded with neighbors, local authorities, and paramedics gathered outside the house, leaving him confused about what is happening, especially after being warned that no one is allowed to enter without wearing a mask and being sprayed with disinfectant. When he finally steps inside the house, he discovers total chaos, clutter everywhere, along with an unbearable odor that no one seems able to tolerate. Suddenly, his eyes land on the patient, a woman suffering from extreme obesity, weighing around 500 pounds, possibly even more. Then he realizes that she has not moved from the couch for years, to the point where it has practically become part of her body. Her skin stuck to it. Shocked, he asks the head doctor why she was never transported to the hospital, only to be told that it was impossible, as every attempt to move her caused her unbearable pain and screaming, which is why they had no choice but to call him. Afterward, introductions are made, and the woman introduces herself as Muma. Sean approaches her gently and asks how she is feeling today. She tells him that she is fine, explaining that her husband panicked and called an ambulance after noticing she was struggling to breathe, reassuring everyone that she feels better now and does not need immediate medical assistance. When she notices the construction workers staring at her, she becomes uncomfortable and asks Sean not to let them look at her that way. So he orders them to step outside, leaving the two of them alone. Then he asks her how long she has been unable to get up from the couch, and when she tells him it has been 3 years, he is completely stunned. Asking her to explain further, she tells him that she suffers from sciatica, a severe pain that runs from the lower back all the way down the leg, explaining that every single step caused her unbearable pain, while sitting down made it slightly more tolerable, which is why she eventually stopped moving altogether. She then explains that the television in front of her stays on 24 hours a day to keep her company, and although her husband tried to help and suggested seeing doctors, over time her weight increased even more, making it nearly impossible for her to move at all. Then he asks her about her eating habits, and she tells him that Donnie visits her once a week, bringing her everything she craves. When he asks how she manages to use the bathroom, her expression immediately changes, and she refuses to answer. And from the smell filling the house, he already understands the truth on his own. He gently warns her that he is about to examine her skin, telling her she may feel a little pain and asking her to bear with him. At that moment, he discovers exactly what he feared. Her skin has adhered to the couch in a way that makes separating them impossible without medical intervention, requiring the removal of multiple layers of damaged tissue. After finishing the examination, he hides his reaction, politely excuses himself, then steps outside to speak with the head physician, making it clear that immediate action is necessary and that she must be transferred to the hospital as soon as possible, explaining that she has been using the bathroom in the same place for 3 years, allowing bacteria to spread everywhere until her skin tissue deteriorated and fused with the couch, now requiring urgent surgical intervention. The head physician responds coldly, saying that she has been like this for 3 years and another hour will not make a difference. However, Sean firmly warns him that she is essentially rotting and that any blood clot in her legs could travel to her lungs at any moment and end her life. He clarifies that all he needs is to move her legs, yet the only way to do that is by getting her off the couch. And since that is impossible, she must be taken to the hospital immediately. The head physician then asks how that could possibly happen, pointing out that she cannot even fit through the door, let alone be moved along with the couch. At that moment, Sean looks around and comes up with a shocking solution, tearing down the wall to get her out. Everyone is stunned by the idea. Yet the construction workers immediately begin demolishing the wall. Once they succeed, Muma speaks to Sean, begging him not to take her out in front of everyone like that, reminding him that people will stare and mock her. So he asks the workers to bring a tarp or a curtain, and they quickly comply, using it to shield her from the crowd. Meanwhile, the construction crew secures the couch and prepares to move it, with more than 30 men lifting both her and the couch together, eventually placing them onto a crane. She calls out to Sean and asks him to bring her husband so he can come with her, explaining that she feels safe only when he is nearby. He gently asks for her permission to stay in his place, assuring her that he will ride with her and will not leave her side, holding her hand and calming her down. Soon, the news reaches Troy, who arrives at the hospital along with their assistant Lisa. They meet Sean there, and Troy personally briefs him on the case, urging him to get ready quickly since they have an operation scheduled immediately. Troy looks at Muma, stunned, as this is the first time he has ever encountered a case of obesity this extreme. Shortly after, Sean returns, dressed in surgical scrubs, reassuring her that she will receive local anesthesia and will not feel anything. Then we learn that the surgery will be performed while she remains awake, since losing consciousness in her condition would be too dangerous. When Sean promises her that she will get through the procedure safely and feel better than before, she tells him that she trusts him completely, while also reminding him that she hates needles. In front of us, we see more than 100 syringes neatly lined up. Troy then prepares as well, putting on his surgical gear and joining him, injecting her legs one needle after another until only about 20 injections remain. At that moment, Lisa pulls them aside, warning them that she cannot handle any more injections and could suffer a sudden heart attack, pointing out that even the amount of anesthesia already given puts her life at serious risk. Sean quickly agrees with them that the only option is to perform the surgery in stages, working on one area at a time. Meanwhile, her husband Donnie arrives at the hospital. Sean steps out to speak with him, introduces himself as the doctor who will be operating on his wife, and Donnie insists on seeing Muma before the surgery begins, something that is now impossible after the room has been sterilized and she has already been given such a heavy dose of anesthesia. Sean calmly explains that any contamination could cost her life, assuring him that he can see her after the procedure. However, Donnie becomes agitated and insists on seeing her, arguing that he is her husband and has rights. Sean snaps back angrily, asking if those rights were leaving her on that couch for years, sending her enough food to last a week, and placing a television in front of her so she would not have to move, implying that if he truly loved her, he would have asked for help long before her condition deteriorated to this point, even threatening to file a negligence lawsuit against him. Yet Donnie insists that he loves her deeply, claiming that he always wanted her to lose weight and that he tried many times to help her. They begin preparing her for surgery as the anesthesia starts to take effect. Sean and Troy take a deep breath, each gripping his scalpel. Then they start working on one leg, carefully removing the layers of damaged tissue, only to discover that she is suffering from a stage 4 infection that has reached the bone. Terrified, Muma asks if that means they are going to cut off her leg, and Troy answers her honestly, explaining that if they cannot control the infection, amputation may be the only option. Overwhelmed with sadness, she asks how she would ever get off the couch if both legs were amputated. At that point, Sean tries to distract her, telling her that her husband is waiting outside and offering to bring him in so he can hold her hand and comfort her. But she refuses, explaining that she does not want him to see her like this. Then Troy removes his surgical glove and reaches out his hand for her to hold, leaving Sean to continue the procedure alone, casually complimenting her manicure. She tells him that it is the only thing she is still able to do, adding that her daughter used to tell her she was very good at it, surprised to learn that she has a daughter. They ask her about her, and she explains that her daughter used to visit every week, but has not come in over a year, admitting that during her last visit, she told her she could no longer bear seeing her in this condition. She goes on to explain that she always cared deeply about cleanliness and keeping her home tidy, yet day after day, her legs felt heavier until she could no longer move. At that moment, Lisa enters the room after being sent to the lab with a skin sample for testing. When they ask her what stage the infection has reached, she remains silent, refusing to answer in front of Muma. And they immediately understand, struggling to keep their expressions neutral so she will not panic. The three of them step aside to talk privately. Sean warns them that Muma has lost a significant amount of blood, her blood pressure is dangerously low, and she will not survive operating on the second leg. While Troy points out that separating her from the couch alone could take days, possibly even weeks, and that they need to find another solution. At that moment, Muma looks around and notices the blood-soaked pads scattered everywhere, suddenly realizing that this might be the end and that she may not survive the operation. Then, without warning, the heart monitor begins to alarm as she suffers a sudden cardiac arrest. Everyone rushes to resuscitate her and prepare to intervene, only for Lisa to shut off the machine and explain that Muma had signed a do not resuscitate order before entering surgery. Her vital signs continue to drop, and within moments, Muma says goodbye to life, leaving them all devastated as she becomes another victim of extreme obesity. They take responsibility for her funeral expenses, and her daughter attends the service, telling them that she knows they will judge her and wonder what kind of daughter abandons her mother in such a condition without checking on her. Yet she explains that it was Muma herself who asked her to stop visiting and not see her like that. Donnie arrives as well, thanking them for everything they did for his wife, explaining that they purchased a burial plot and a large metal casket to accommodate her, admitting that he had been terrified of the financial burden the moment he received the news. After he leaves, Troy tells Sean that this case helped him rediscover his passion for the job and pushed him to return to work after taking 2 days off, urging him to get moving since they have many cases waiting at the clinic. The following day, a new patient comes to Troy, a Michael Jackson lookalike who has undergone several facial surgeries to resemble his favorite singer, having built his own fame, fan base, and income around his resemblance to Michael. He comes in requesting a third nose surgery to fix a visible deviation, claiming that many people recommended Troy as the best plastic surgeon in the country who could easily solve his problem. Troy listens carefully, takes notes, then diagnoses him as a man living in delusion, bluntly telling him that as a doctor, he must advise him to stop undergoing unnecessary cosmetic procedures, asking him a simple yet powerful question about what truly matters, looking like his idol or being able to breathe properly. Then with calm professionalism, he makes it clear that he refuses to take his case and asks his assistant to escort him to the door. We then shift to Sean, sitting at home with his family, dealing with yet another crisis involving his son Mati after the boy acts recklessly and accidentally injures himself. Sean reassures him that everything will be fine and promises to personally handle his surgery and fix the problem. However, the family drama does not stop there, as a police officer suddenly knocks on their door, explaining that he needs to speak with Sean's wife, Julia, asking her a few questions. The officer steps inside and informs her that she was involved in a car accident that resulted in the death of an animal, clarifying that it is only a misdemeanor and that she must pay a $5,000 fine. Just as Sean is about to defend her and insists that his wife could never even hurt an insect, Julia stops him and admits that she did, in fact, cause the accident. The next day, Sean meets Troy and vents his frustration, telling him that his son tried to mutilate himself while his wife killed an animal, joking bitterly that he feels like he is living in a psychiatric hospital rather than a home. Troy seems distant and unresponsive, and when Sean asks what is wrong, Troy confronts him for firing the psychologist without his approval and hiring someone else without even informing him. Sean tries to justify his decision, but Troy accuses him of doing it out of jealousy, claiming he felt the psychologist was stealing the spotlight from him. Sean immediately denies it, explaining that 75% of their patients are women, and that he believes they would feel more comfortable talking to a female psychologist rather than a man, adding that he is simply doing what is necessary to keep their clinic number one in the market, instead of losing patients to other hospitals. Troy responds by saying he will believe him this time, but then bluntly tells him to be honest with himself, accusing him of hiring Grace because he is attracted to her. Afterward, they head into surgery together to prepare for Maddie's operation. Troy refuses to let Sean operate on his own son alone and insists on assisting him, reassuring Maddie that the procedure is simple, routine, and something they have done many times before, promising him that he will be just fine. Once the nursing team asks Maddie to count from 1 to 10 and he loses consciousness, Troy notices that Sean's hands are shaking from stress and anxiety, so he steps in and tells him that he will take over the operation, suggesting that Sean instead handle Troy's scheduled tummy tuck surgery. Sean agrees, and the two of them switch roles. He heads in to perform the surgery on Agramen's patient, opening her abdomen and removing the excess fat and loose skin, then carefully stapling the incision and bringing the operation to an end. Later that day, Grace approaches Troy and hands him the lab results for Peacock's tests, explaining that the patient is taking psychiatric medication. She tells him that in her opinion, there is no justification for performing such a dangerous surgery on someone suffering from depression, whose medication is clearly not working, pointing out that Peacock's problem is psychological and that ethically, they should refuse her case. Troy dismisses her concerns without hesitation. At that moment, Sean arrives, listens to what Grace has to say, and takes her side, agreeing that they should reject the case. Troy immediately loses his temper and pulls Sean aside to speak privately, accusing him of agreeing with everything Grace says simply because he is attracted to her, doing so at his expense and at the expense of his patient. Sean fires back, reminding him that they hired a psychologist precisely to rely on her professional judgment in cases like this, explaining that the patient is on psychiatric medication and has lithium in her system, which makes surgical complications far more likely and could easily cost her life, adding that she may be experiencing a manic episode and is not thinking clearly. Troy pushes back, arguing that a surgery like this could completely change her life and help her far more than 1,000,000 pills ever could. Sean refuses to back down, telling him that not every patient who walks through their door should automatically be accepted. Troy snaps, accusing Sean of implying that he lacks ethics and exploits vulnerable patients for profit. Sean does not deny it, bluntly stating that Troy only cares about money. Troy immediately objects, pointing out that he rejected the Michael Jackson lookalike earlier that same day, proving that accusation false. Sean brushes that off and shifts the conversation back to the serious risks of the operation. Troy cuts him short, arguing that if they focus on risks, they would never finish, since no surgery they perform is ever 100% guaranteed. Sean tries to calm him down, firmly explaining that they cannot take on a case with this level of danger right now, then ends the discussion by making his position clear. They will not accept the case, giving Troy a choice. Either he calls the patient himself to inform her, or Sean will do it. At the same time, we see Peacock pushing herself to the limit, relentlessly dieting and exercising in an attempt to lose some weight before the surgery, when she receives a call from Troy, who apologizes and tells her that they will not be able to perform the operation next week. She immediately responds that postponing it for too long is not an option, since her graduation party is next month, and she needs time to recover from the surgery's effects. Troy then shocks her by clarifying that he is not calling to postpone the procedure, but to cancel it entirely. She panics and tells him that she knows her weight is still high, adding that the nurse already informed her she needs to lose 10 kilos before the operation. Promising that she is doing everything she possibly can, Troy calmly explains that the cancellation has nothing to do with her weight, but rather with ethical concerns, telling her that they believe she may be going through a serious psychological struggle and that every hospital has its own standards, recommending another doctor who might be able to help her. Peacock explodes in anger, insisting that she does not not have time to start over with new consultations and medical tests, then offers him more money, telling him to name his price. Troy patiently explains that money has nothing to do with the decision, but she cuts him off in rage and hangs up. Later that night, Troy heads to the garage and finds his car completely vandalized. The next morning, when he takes it to the mechanic, the man hints that whoever did this was extremely angry, leaving Troy convinced that Peacock is responsible for the damage after he refused to perform her surgery. Shortly afterward, Sean calls him asking why he is running late, reminding him that they have another operation scheduled soon. Troy downplays the situation, saying he is dealing with a minor issue involving his car. Sean then questions why the schedule shows a neck lift procedure booked for Agraman, even though they already operated on her. Troy is confused and insists that he never scheduled any additional surgery for her, pointing out that she underwent the same procedure just a year ago, making it clear that something is not right. Concerned, Troy calls Agraman, and as soon as she answers, he checks on her condition. Learning that her wounds have begun to heal, she warmly tells him that it was thoughtful of him to call and personally check in on her. After she finishes speaking, Troy asks her who placed her name back on his surgery schedule, and she bluntly admits that she bribed the nurses to add her. He makes it clear that he never agreed to perform this procedure, but she ignores his refusal and explains that she has a charity gala next month with influential guests in attendance, insisting that she must look her absolute best. Troy loses his temper and warns her not to make decisions without consulting him first. Yet she pushes back, telling him that she does not appreciate his tone and that he should think twice before speaking to her that way, confidently assuring him that she will show up on the day of the surgery. Troy firmly explains that he cannot operate on her since less than a month has passed since her last procedure, reminding her that this goes against professional ethics. She mocks him in response, sarcastically asking if he is suddenly going to preach ethics to her, questioning since when he ever cared about morals. Through their exchange, it becomes clear that their relationship goes far beyond that of doctor and patient. In the end, Troy shuts down the conversation entirely, telling her to find another surgeon because from this point forward, he will not perform any more procedures on her. The following day, she arrives with her lawyer, accusing him of leaving a metal instrument inside her abdomen, claiming it was discovered by security when she passed through a metal detector. They present him with an X-ray image, revealing that her personal doctor immediately intervened and removed it. Sean apologizes to her on Troy's behalf, but she corrects him, stating that Troy is the one who owes her an apology. Troy then contacts her directly and asks what kind of compensation she is demanding, and she coldly demands $10 million. Afterwards, Sean lashes out at his assistant Lisa, blaming her for not being more careful. She defends herself, reminding him that as a surgeon, it is his fundamental responsibility to ensure that no foreign objects are left inside a patient before closing an operation, stating that these are standard surgical protocols. She then points out that his son's surgery had clearly distracted him, implying that if anyone was negligent, it was him, not her. Sean immediately apologizes, admitting that he should not have spoken to her that way, but Lisa refuses his apology, informs him that she is resigning, and walks away. As for Troy, he openly mocks Sean, sarcastically calling him the great and flawless Sean who never missed a chance to lecture him about responsibility, only to make a mistake no first-year medical student should ever make, bluntly telling him that this time they are truly in serious trouble. Sean grows increasingly worried that Agraman might expose them and leak the story to the press, making it clear that if that happens, it would destroy their future and completely shatter public trust in them, hinting that there is only one possible solution. He suggests that Troy should go and smooth things over with her, reminding him that she is clearly attracted to him and that he might be able to convince her, then blames him by saying that if he had not refused her case in the first place, none of this would have happened. Troy fires back, saying that he did it for Sean's sake, but Sean responds that he never asked him to do anything, reminding him that Troy constantly accuses him of ignoring medical ethics, so he has no right to blame him for refusing a patient who had just undergone surgery recently, insisting that Troy is just as responsible for this mess as he is. Just like he was responsible for Peacock vandalizing his car, the argument quickly escalates into a childish fight, with each of them blaming the other, until they finally reach an agreement. Sean will handle the Agraman situation himself, while Troy agrees to deal with Peacock alongside Grace. Later, Grace goes to Peacock's house and notices the walls covered with photos of plus-size models, fashion icons, and celebrities, immediately realizing that Peacock is obsessed with the idea of beauty and desperately wants to look like them so people will see her as attractive and lovable. Peacock appears and asks about the reason for the visit, and Grace explains that she is there because the doctors wanted to check on her. Peacock responds bitterly, saying that as she can see, she is doing just fine, doing her laundry and preparing dinner, adding sarcastically that she will not even attend her graduation party because of them, and hoping they are satisfied. Grace then tells her that she noticed Peacock stopped taking her medication and that the lab results clearly show signs of withdrawal, asking whether her psychiatrist is aware of her decision. Peacock calmly admits that she no longer sees him and has not taken her medication for over a month, explaining that it never helped her and that she had placed all her hope in the surgery, then accuses them of betraying her as well by refusing to help, finally confessing that she has a crush on Jim, her classmate, and that she wanted to show up with a new look in hopes of finally catching his attention and making him notice her. Peacock suddenly changes her tone and tells Grace that if Jim ever saw her, he would probably be attracted to her, explaining that guys like him only like girls with perfect bodies, flawless and ideal, not someone who has to wear a corset under her clothes. She goes on to say that she hates girls like Grace because they attract men effortlessly without even trying. Grace notices how agitated she has become and grows genuinely afraid of her, especially when she sees the sharp object in Peacock's hand as she slowly moves closer, trying to diffuse the tension. Grace gently asks her about Jim. Peacock opens up and talks about him, pointing at the photos behind her, explaining that she wanted to look like those women just so he might notice her or even talk to her. Then, she bitterly adds that because of them, that dream will never come true. Grace responds calmly, suggesting that this is why she wanted revenge on Dr. Troy and vandalized his car, subtly warning her not to take a doctor's professional refusal so personally. But Peacock becomes even more aggressive, snapping that destroying her dream was personal. Denying her the chance to change and become a new person was personal. She breaks down, admitting that she is exhausted from constant bullying and rejection because of her weight, then firmly tells Grace that the visit is over and orders her to leave and never come back. Meanwhile, on the other side, Troy goes to Agraman's house and apologizes, only for her to coldly tell him that his apology means nothing to her. Troy asks why she is doing all of this, knowing full well that she does not need the money, especially since her late husband left her an unimaginable fortune. Agraman responds that she is doing this because he abandoned her, accusing him of always acting as if he created her through his surgeries, when in reality, she was the one who made him, reminding him that without her money, her connections, and the powerful people she sent to his clinic, he would be nothing. She continues humiliating him, saying that her parties and invitations were the reason he became famous and recognizable. Then adds bitterly that after all of that, instead of thanking her, he chose to walk away. Troy steps closer and tells her that to him she is his masterpiece, that he never saw her as someone who needed fixing, because in his eyes she had already become perfect, admitting that he failed to express himself properly before and apologizing for that. However, Agraman is not moved by his words, pointing out that hearing this from him had always been her dream, then asks him to seriously consider her offer if he wants to save their clinic. Later, Troy reports back to Sean, confirming that Agraman hinted that if he performed the surgery, she would drop the lawsuit, but Troy shuts the idea down completely, telling Sean to forget it and that he will not go anywhere near that woman to fix Sean's mistake. Sean then admits that Troy was right all along and that Peacock was behind the car vandalism, advising him to go to the police. Troy refuses, saying this is not the time to act recklessly or take risks, reminding Sean that this was his own advice, leaving them both unsure how to handle the mess. Troy points out that if they do not pay the compensation Agraman is demanding, she will shut down their clinic, then adds bitterly that after his entire career in plastic surgery, he has no intention of waking up in his 40s only to find himself working at a call center inside a candy shop. Sean suggests negotiating with her lawyer and paying from the savings the two of them share. Once Troy realizes the settlement will come out of his own pocket, he immediately softens his approach and decides to play nice with Agraman. Meanwhile, Sean leaves Peacock a voicemail, explaining that he knows she came to the clinic last week and spoke with his partner, asking her to come in today so he can meet her personally, leaving her a specific appointment time. She listens to the message while getting ready to see him. On the other hand, Troy meets Agraman at the clinic and finds her scheduling a date for her surgery. When he reminds her that he still refuses to perform the operation, she coldly responds that he will do it. And not only that, from now on, she will get every procedure she wants, completely free of charge, making it clear that all her surgeries at their clinic will be done without paying a single dollar. After she leaves, Sean sarcastically delivers the great news, telling Troy to enjoy the consequences of his mistake, since their wealthiest patient will now never bring them a single dollar for the rest of their lives. Shortly afterward, Sean is informed that his patient Peacock has arrived and that he will meet her alone. Once inside, without any introduction, she tells him she is ready to have the surgery tomorrow and has even brought makeup powder to conceal any bruises afterward. While she speaks, Sean notices her hands trembling and immediately realizes this is a result of stopping her psychiatric medication. He shocks her by explaining that he did not ask her to come in to schedule surgery, making it clear that his real intention is to genuinely help her. She responds by saying that the only way he can help is by changing her body and appearance. But he firmly explains that she cannot stop her medication on her own, warning her that doing so could trigger a severe episode that would be difficult to control. Then recommends a psychiatrist he personally knows who specializes in cases like hers. She rejects his words, insisting that she is not crazy, but Sean reassures her that she would not have to pay anything and even offers to take her himself to meet the doctor. She tries to remain calm, opens her bag, pulls out a pen, and asks him for the psychiatrist's number, leaving Sean relieved and hopeful that his words finally reached her. Later that day, he returns home and checks on his son's condition. Mati thanks him and Dr. Troy for helping him, telling his father that he is lucky to have ended up in the hands of the best plastic surgeons, which deeply warms Sean's heart. Meanwhile, Peacock sits alone in front of the wall covered with photos of beauty queens and fashion models, overwhelmed by the feeling that she is inferior to them because of her weight. Falling into a severe depressive episode, she finally gives up, places a gun in her mouth, and ends her life after losing all hope of ever looking like them. The truth is that what drove her to this point was not the doctor's refusal to operate, but the cruelty of the people who bullied her and planted the idea inside her that appearance is everything, making it painfully clear that obesity and bullying claim countless victims and that their danger can be far greater than surgery itself.